Tonight on Nation to Nation, we take a closer look at the death of Sacha Raven Bob. She died by suicide 6 years ago while in the care of a First Nations child welfare agency. Details of her life were documented in an internal death report obtained by APTN.
There was physical neglect, there was educational neglect, there was medical neglect. There was an utter failure to protect this 12-year-old girl.
Nation to Nation producer Kenneth Jackson helped break this story last week on APTN. He has written about multiple deaths in care, but this is the first time he obtained an internal death report.
It's telling that even though I write about this all the time, I've never come across one before. They're very hidden, they're very hard to get, and they basically exist in secret.
Hello, I'm Todd Lamoran, and welcome to Nation. This week we're keeping the spotlight on the child welfare system. In particular, the death of Sacha Raven Bob. She was only 12 years old when she died alone in the closet of her bedroom on September 10th, 2014. She was sexually abused and neglected while in the care of the Wichita Family Services. That agency in northwestern Ontario failed to meet any government regulations, and it even ignored her suicide note the day before she died. Tonight we break down the internal death report into Sacha's death with the help of Dr. Kim Snow. Dr. Snow is a professor at Ryerson University and a leading expert in child welfare. Welcome to Nation, Dr. Snow. Thanks for having me. You've reviewed a copy of the internal death report. Let's begin with, what is this report about?
This is a report that any Children's Aid Society would undertake should there be a death review to understand whether basic standards of care have been met in this situation. And so this is provided to the Ministry and the Office of Chief Coroner with the hopes of reviewing practice and preventing a recurrence.
What were your immediate thoughts on what you read?
I mean, my immediate reaction was not again. And as I went through the report, it was heartbreaking. This is a 12-year-old little girl, and it detailed multiple failures to protect. There was physical neglect, there was educational neglect, there was medical neglect. There was an utter failure to protect this 12-year-old girl for many, many years.
What's a plan of care? And I ask because the report shows the agency had no plans of care for Sacha, totaling 7 years.
Well, this is the plan to protect, first of all, protect the child. We have to remember we're talking about child protection. The primary purpose of the plan of care is to protect the child and plan to ensure their protection and well-being. So it should be a roadmap to look at how are we going to keep this young person safe, and how are we going to prevent the circumstances that made them unsafe to begin with, and prevent a repeat.
Her file says she began showing sexualized behavior at the age of 4, and then reports there were cases of sexual abuse later in her short life. But can you see evidence it was ever addressed?
I see absolutely no evidence that there was any follow-up to these incidents. I think this is a good example of the failure to protect. There's some young boys who are implicated in this failure to protect who also, this is a child protection concern. They too deserve some intervention by a child protection agency to prevent this kind of behavior. There seems to be no follow-up counseling. And I would suggest that there's indications that there's more than one incident that didn't get investigated.
I know you kind of touched on it in one of my earlier questions, but what sort of life did Sacha have in care based on what's in this report?
Well, this report, if the general public read this report, they would be shocked at how many opportunities there were to intervene and how few attempts they did make to provide some stability in care. You know, Sacha wrote in her suicide note that she missed her sisters and that life is too hard. She's a 12-year-old little girl. Life was too hard at 12. That speaks to the lack of basic care and safeguards and stability provided for this young girl.
Now, you've brought up this suicide note, which she wrote the day before she died. What do you think of the fact that Sacha's worker didn't respond to this note After all, two of her sisters had died by suicide within 7 months.
There were so many indications that suicide was maybe even a likely outcome, how often she was talking about suicide, the family history of suicide, her missing her sisters, her instability. There were all the red flags to say that this young child needed to be in the highest alert of care and should have been under one-to-one supervision at all times.
The death report appears to have been rushed. Can you explain how and whether the Ontario government should have accepted this report?
It's a hard question to answer because there's no standards to say what would be an acceptable report. But I look at this report and I see a lot of inconsistencies and errors, and it doesn't really match to standards that I would like to have seen. But even more importantly, I would like to see what is the outcome of this, and that's where the ministry needs to be held to account. Did the ministry follow up with the board to ensure that this child welfare agency was meeting its mandate? I see no evidence of that.
You talk about standards. What would you like to see tightened or higher standards going forward?
Well, I'd like to see this agency and other agencies like it that are struggling to meet minimum standards of care. These are not very high standards. Getting a medical care for a young person in essentially the care of the province should not be a difficult thing in Ontario, but it is. 7-day visits. Imagine dropping off a child to a stranger's home. They may be an approved foster home, but they are a stranger to this child, and not going and having a face-to-face visit within 7 days. These minimum standards protect the most vulnerable. And so I'd like to see the minimum standards of a child in care at least meet what the review standards would be for auditing a child in care file.
You've seen other work done by APTN on this agency that I mentioned in the intro. Why do you think the Ontario government stepped in?
I think the Ontario government needed to step in. This is an agency that has many documentations that suggest they know they have a problem. The summer before Sacha Bob died by suicide, they had indications that the files were not compliant. Non-compliant files mean that young people are not being visited. Young people's medical care is not being attended to. Young people's educational care is not being attended to. That is the purpose for them to be in care. And the Child Welfare Agency has an enhanced duty to care for this child. And they are obligated to meet those minimum standards as part of their contract as a Child Welfare Agency.
Now, again, you kind of touched upon it in this previous answer. But is this report an indication of what life is like for First Nations children in care based on your experience?
The Child Welfare Agency is failing First Nations children. It is a colonized system. It is a system that provides less resources in the far north than down south, and is carried on in name only as First Nations run. They have to meet the same standards, they meet under the same law, and the end result of the less funding, less qualified staff, fewer resources, is that young people are dying.
The fewer resources, I suppose, where do they need to come from? Is this just on Ontario's shoulders, or does the federal government have responsibility in this as well?
Both have responsibility, and we have to be careful that we don't talk about funding only child protection. Child welfare, the broader child protection mandate, is actually prevention. So community centers, daycares, school programs, visiting homemakers, elder visits, all these kinds of things that support young families to prevent the circumstances that lead to child protection involvement. The other thing is poverty. Poverty is the biggest driver of child protection, and we need to address basic needs like water, shelter, and food.
Dr. Snow, I want to thank you for bringing your insights into this. Thank you.
Thank you.
After the break, Nation to Nation producer Kenneth Jackson tells us that Sacha's death is the tip of an iceberg. Welcome back. Nation to Nation producer Kenneth Jackson has been digging into Ontario's child welfare system for several years. He first broke the story on the internal death report of Sacha Raven Bob and the inequalities in a system that has led to a staggering number of deaths in First Nations agencies. In fact, since 2013, of the 178 Indigenous children who have died connected to the child welfare system in Ontario, 147 of them are tied to First Nations child welfare agencies. That's 82.5%. Kenneth now joins me to discuss this. Welcome to Nation to Nation, Kenneth.
Thanks, Todd.
First, tell us, was Sacha's death preventable?
Absolutely. That's a short answer. And that's because the day before she died, her worker got a call from someone saying, "I have her suicide note. She's saying goodbye to somebody." And that worker didn't respond quickly. She was like, "Oh yeah, I was there, last week. No big deal," kind of thing. And then the next day, she comes into work and she doesn't react to it right away either. And it was too late. Sacha had died by that afternoon. That's just one example, ignoring the suicide note, and you have to understand, it wasn't just any suicide note. Her one sister had died 3 weeks prior to that, another one 7 months prior. This was a child that was teetering on death, and everyone knew it.
We know these deaths aren't rare, but how often have you come across a fully unredacted death report like Sacha's?
I've done a lot of deaths, and I've never seen one of these before. Every child has one. So considering that I've been doing this for 3 years, I've seen kids die on video, I've seen them try and kill themselves on video, I've seen their coroner reports, their police investigations. This report has everything in it, like an audit of their child welfare file, the coroner report, police reports, everything. I've never seen one before. And it shows you that in these documents, or in that report, exactly what happens to that child throughout their life and leading to their death. It's telling that even though I write about this all the time, I've never come across one before. They're very hidden, they're very hard to get, and they basically exist in secret.
What's the response been from Wichita when on this story?
Nothing. They've never responded to anything on this. We send emails. When I do a story, I provide the other person ample time to comment. I provide them many ways to comment. There's no excuse for not commenting at all on this young girl's death or anything that happened to her leading up to it. There are ways for Wichita to comment. They have refused not to by simply ignoring us.
In fact, you've written several stories on this agency in just the last few weeks.
October 15th was our first one. It was on a kid with a deformity, a rare one, and we obtained his medical records, and it showed that Wichita had neglected him as well in care. And he's 15 now, and he's trying to correct this rare deformity, and he's still having trouble getting that done.
How does Sacha's death compare to all the others that you've uncovered?
It's having read that report, like I told you, I watched Kanaya Stu Turtle die on camera. She filmed it. That was my first real entrance into child welfare, and that's tough. But reading just how neglected she was, how many regulations were neglected, how many times she was ignored, it stands above the rest because of the severity of it all and what I was able to see. But the reality is, her death, there's many more like it. Like all the other deaths, like most of them are exactly like this.
Why do you think 80% of all the deaths involved First Nations agencies?
Well, there's been a big push over the last 30 years for First Nations to take control over their child welfare. Unfortunately, that's tied to a colonial system. They're mandated by the province. And they've also been treated a bit differently. They have different rules surrounding how kids go into care. And one of the things we're finding is customary care is a common term used to bring a child into care. We ask I've asked everyone that exact same question, and their answer is there's so few customs or traditions in customary care that it's no different. These agencies are literally no different than any other agencies, except they have this window dressing of Indigenous culture. I haven't seen it. We don't see it.
We've been told mainstream agencies adhere to government guidelines but lack culture, as you've suggested, while First Nations don't adhere to guidelines. Do they really have the culture that they claim to have?
No, they don't. Like obviously they do. It's there. But these agencies also mirror what's happening in the communities. Like for Wichitawin, they have 10 First Nations that they oversee. A lot of the problems that I'm finding in Wichitawin are you'll find on reserve in the communities. Everyone's in a different state of their healing journey from colonization, and you really see that in Northwestern Ontario, which might be another reason why there's these lags, or why you might find more deaths happening with these nations or with these agencies, because the communities are still struggling.
So Kenneth, what's next?
Sex abuse. Every single person I spoke to, every single woman, every single child had a story. Some of them more than one, multiple times. I know everyone knows this. Our viewers know this. The women watching the show know this. This is a massive underlying issue to child welfare, poverty, whatnot. But when you break a child at such a young age with sexual abuse, they can sprout out of control, and it can lead to more things, and it can lead to longer times in care. It can lead to it's created a ripple effect itself, and I think it's time that we really dig into that, and there's some hard truths that need to be brought forward.
Well, I know, Kenneth, you're going to bring those things forward and expose them to the light. Keep at it. Thank you.
Thanks, Todd.
After the break, officials from Indigenous Services Canada and FNIB will be here to talk COVID cases and vaccines. Welcome back. Despite talk of vaccines, the COVID pandemic is expected to be with us for several more months. The fall has been bad for rising cases, especially on First Nations. Shamattawa, northern Manitoba, is an example of one community particularly hard hit. To explain where First Nations communities are in terms of infections, and perhaps when the light at the end of the tunnel for them is expected, I'm joined now by Valerie Gideon, Deputy Minister for Indigenous Services, and Dr. Evan Adams, Deputy Chief Medical Officer for Indigenous Services. To both of you, welcome to Nation to Nation.
Thank you.
Hi there.
A community hit hard like Shamattawa in northern Manitoba has been asking for more federal help. Will it be forthcoming?
Absolutely. We have been able to work collaboratively with the Canadian Armed Forces. They have come to the community in order to be able to assess the needs, and will be providing a report with respect to their recommendation around what additional resources are required. There is a rapid response team that's on site. The Bear Clan is on site. Rangers are on site. And we will continue to do whatever it is that we can to support the additional community needs, relating really to, the extra community capacity that's required. A lot of community workers that would exercise those roles are in isolation or may themselves be infected with COVID-19. And so it has really exhausted the community capacity. And so that is why additional resources from outside the community are required. We're also working collaboratively with multiple partners to ensure that there are isolation spaces that are available in Winnipeg, so that those particularly more elderly individuals that are vulnerable to COVID-19 would be able to isolate in Winnipeg with the appropriate clinical supports available to them.
This next question might be for you, Dr. Adams. What do First Nations still need to do as we head into the holidays, or more specifically First Nations leaders?
Sure. Well, this is the numbers of First Nations people on reserve who have COVID in the Western provinces particularly is alarming, and our modeling is showing that there's no sign of decrease in January, and we have the Christmas and New Year's holidays coming up, where we expect people to be interacting more than they normally would. We would like to remind people that now is not the time for visiting, that we should be limiting ourselves to only our single households, and that even visiting outside is not recommended. So it's a time for us to be strict with ourselves. It's not for much longer. We need to socially distance, and we need to wash our hands and wear masks and not be out in public, or at least limit our activities out in public while we're shopping and doing our activities of daily living. And I feel like everyone knows the drill 9 months in. It's just really too bad that the numbers have increased as much as they have in the second wave. We did so well in the first wave, but not much longer. The vaccine is on the horizon, and we're hoping that will give us much more safety and comfort.
Now, of course, as you mentioned, Dr. Adams, the vaccine is on the horizon, but we don't know when it's going to be rolled out. I mean, when can we expect a plan to immunize, especially remote northern First Nations?
Well, we have been given assurances that the very first vaccine, and remember there are as many as 7 in development. The second vaccine may follow quite quickly after the first, but we are expecting 299,000 doses in the country before December the 31st, and we will start vaccinating those priority groups. And those Indigenous communities with the most risk, particularly adults and particularly those in older age groups, will be in the first group if they choose to go.
Ms. Gideon, how disheartening, though, is it to hear Manitoba Premier Brian Pallister criticize that First Nations will somehow skip to the front of the line in getting immunized?
I think it's important to remember that, recommendations of the National Advisory Committee on Immunization were released at the beginning of November and again last Friday. Their advice is based on science. It's not based on jurisdiction. It's not based on anything else, but really looking at the vulnerability of specific individuals. And so we are strongly promoting adherence to the National Advisory Committee on Immunization guidelines, but we are also really encouraging provinces and territories to engage with Indigenous partners in each of their jurisdictions in the planning efforts so that there is a sharing of information and that there's collaboration around the logistics. As Dr. Adams noted, a prioritization of populations is important, but particularly in the first quarter. After that, there will be quite a bit of supply of the vaccine. And so the focus also has to be on the logistics. Do we have enough health human resources to administer the vaccine? What if a community is confronted with an outbreak, but the vaccine also becomes available at that same time? So making sure that that planning is in place. We also want to work collaboratively with Indigenous partners on communications products, right? So specific First Nations products, Inuit products, Métis products, and at the regional level, because we are concerned about vaccine hesitancy. We can work very, very hard to make the vaccine available in a timely way to those vulnerable individuals and in remote and isolated communities. But the pickup has to be there, right? People have to have trust in the vaccine, in the science-based recommendations. And so we need to ensure that they have access to that information so that they can exercise informed individual choices.
Well, I hope that there is some light at the end of this tunnel. It's been a long, hard haul. I want to thank the both of you for speaking to me today.
Thank you very much, Will Allen.
That's our show for this week. I'm Todd Lamoureux. I hope everyone is staying safe, and thanks for watching.